I'm also Ben. I have a two-part question for you.
No relation. Okay.
The first is in response to an article you wrote about healthcare and armchairs.
Yes.
And my first
This
question,
one, the left hated this one. Oh, yeah.
I was not a fan either. But
good. I'm glad you came in.
yeah, thank you. So I was wondering, you said that if you had to go find a cheap X-ray or a cheap armchair, you would go to find an armchair.
If your life depended on, you have to find a chair today and buy it now.
Yes.
Versus you have to find an X-ray and buy it now. You would buy the armchair, yes.
Yeah. So my question is, part of what allows you to find a cheap armchair is that there's such a difference in quality.
Yes.
You know, you can go and buy a chair that's $5, probably going to break soon.
Yep.
But so with healthcare,
Which I said in the piece, actually.
yeah.
Yeah.
So with healthcare, if it's something you don't really want to go like some guy who's offering a $5 X-ray and say, hey, you want an X-ray? You know,
Why?
So, because if your life depended on it, I don't think that it would be a situation where you'd be willing to risk the.
So let me ask you this: why should an X-ray cost $200, $1,000 through an insurance company? It's literally a machine, and an X-ray technician takes a picture of it and then sends it to a radiologist who actually looks at it. Right, or a doctor looks at it.
So I don't know enough about the healthcare industry to answer that. But
The reason I'm saying this is because what I'm saying is that one of the reasons these things are so much more expensive and so much less competitive is because you do not actually have a free market in healthcare. You have a heavily, heavily regulated market in healthcare. If you want cheap X-rays, you have to have a competition in the X-ray business. There is no competition in the X-ray business. You can't go and look up a list of X-ray companies that are going to give you an X-ray today and then call them for the lowest price. In fact, if you go into the doctor right now and you say, I want you to take a look at this X-ray, how much will it cost me? The doctor will tell you, I can't give you that answer. Right? The doctor will tell you, I'm going to have to talk to your insurance company, or maybe I'm going to have to run it through my system, and then I'll get back to you. Is there any other product in America where if you went into a restaurant and you said, how much is that cup of coffee? They said, drink the cup of coffee, we'll tell you later. Right? It's not a free market. The point that I was making with the armchair comparison is not, of course, that armchairs are morally equivalent to healthcare. Obviously, people need healthcare more. Okay? Perhaps a better comparison would have been bread, right? Because people need bread. Okay? But the reason that bread is cheap is because there's a free market in bread, not because government is subsidizing bread. So the point that I was making is if you actually want to increase supply, the point I was making in that column, and overall about this, is that healthcare is not a right. Healthcare is a commodity. And the difference between those two views is that if you think healthcare is a right, now you're going to use the government to cram down on doctors that they must serve you at a particular price, or cram down on taxpayers that they have to pay for a certain level of your care, or cram down on insurance companies that they can't be insurance companies anymore. They have to be health coverage institutes, essentially, which is when they say that you have to accept pre-existing conditions, it's not an insurance company anymore. If you had a fire insurance company and they said you have to accept pre-existing conditions, it would just be called the piggy bank. Right? You'd burn down your house and then go get fire insurance. So insurance companies don't work that way. So the point I was making is if you view it as a commodity, you're going to end up making it cheaper, more plentiful, more available, more competition. And the case in point of this is LASIK eye surgery, which is really unregulated. So LASIK eye surgery used to cost like $20,000 an eye. Now it costs $3,000, $4,000 an eye. The reason for that is because the insurance companies won't cover it and because there's a competitive market because it's really expensive, right? So lots of doctors now want to be optometrists or ophthalmologists and do this sort of work. This is why my wife's a doctor, so I'm very passionate about this particular topic. They call it the road, which is the successful doctors, radiologists, ophthalmologists, anesthesiologists, dermatologists. All those people basically charge cash and don't work through insurance companies. Right? The vast majority of them work in high-level private industry, and that's if you want to make a lot of money, that's what you do. And so what you're getting is in medical schools, if you're aiming for lots of money, you go into one of those four. You're not a primary care physician. You're one of those four. If you want more primary care physicians, what should you do? You should incentivize it. What Bernie Sanders and the rest of this crew want to do, they declare it a right, and then they take away the incentive. They declare it a right for you to have health care, and then they say to the doctor, you're going to work, and you're going to like it, and we're going to make you work. And this is why there's a black market in healthcare in Canada, there's a black market in Israel, there's a black market in the UK. It's why people come here from all of those places to get their surgeries. So here's the reality about socialized healthcare. Socialized healthcare is good for very, very basic things, right? It's like emergency care. The same way if you walk into an emergency room today and you need an X-ray, they'll give it to you regardless of whether you have insurance, which is true. This is why in California you have a major problem with illegal immigrants who don't actually have health care coverage walking in and to the ER and using it as their health care coverage. Basically, socialized medicine works the same way, except there is no upper echelon. They've made it equal at the expense of the upper echelon. Meaning that if you now want a surgery, you got to wait 6 months online for it because we didn't give any incentive for people to become surgeons. Right? There's no cost-benefit analysis there. If you want more of something, you have to incentivize that thing. And when you take away the market, there's no incentive anymore. That's the answer as to why, that's the very long answer as to why I say healthcare is more like a chair than it is like the air or water, because somebody has to provide it to you. Thanks. Yeah.
I thank you for your answer. I respect your reasoning. I also respectfully disagree. Could I just say one thing? Later this week, Sean King is coming to campus, and I think that it's really important that...
Oh, I wish he'd come today. I would love to talk to Sean King.
I would have loved to see that, but I also want to say I think it's important that, given the current reality of the situation our country is facing, that you go and listen to a multitude of speakers from a multitude of diversity.
I agree. I think everybody should go and listen to Sean King. Yeah. And then I think Sean King should debate me.
Hi, so my question is actually about your opinion on healthcare, because I know that you believe that privatization of healthcare is the most effective means to solve the problems that we have. Yet besides thought experiments, I really haven't seen any evidence for that. For me, when you look at the facts, you look at more socialized programs such as Canada, they spend 10% of their GDP on healthcare, and yet their life expectancy is in the low to mid-80s. You look at the UK, and they spend 8.8% of their GDP on it, and the life expectancy is also in the 80s. But then you look at the United States, we have a more privatized system. We spend 15.4% of our GDP on it, and yet our life expectancy is lower. So my question is, why do you, my question is basically, if you look at all that, what it tells me is socialization of healthcare covers more people, makes life expectancy longer, and it's just more effective all around. So do you have any evidence or examples where privatization has actually increased healthcare?
Okay, so the truth is that we haven't actually seen a move from a socialized medicine system to a privatized system. So it would be hard to find an example where moving from one of those examples to a privatized system works. And we haven't really seen even a system where we move from privatization to universal health care in the sense that the system has never been deregulated. I mean, my basic premise is that what we have now is almost the worst system. We have a mixed system which has driven up costs because of subsidizations from Medicare and Medicaid, and has also driven up costs because of regulation, and then it's still privatized, so doctors are still charging a lot of money. The best example that I can use is a small-scale example because it doesn't exist in large scale. By the way, we can talk about problems in socialized medicine systems. We can talk about the fact that there is rationing of healthcare that does occur in places like Canada and Britain in a way it doesn't with regard to surgery, particularly in the United States. We can talk about cancer survival rates in the United States, which are better than cancer survival rates in socialized medicine countries. We can talk about the fact that it's not you really shouldn't statistically compare life expectancy between Canada and Britain and the United States because the populations are incredibly different. Just in terms of ethnic diversity, the ethnic diversity in the United States is very different from the ethnic diversity of Canada, right? Canada is nearly homogenous. The ethnic diversity in the United States is very different, and different ethnic groups do have different health problems. For example, heart disease is more prevalent in black men than it is in white men. That's just a fact. That has nothing to do with moral culpability or anything. That's a reality that is taught in medical school. It's the way they profile patients. So you'd have to find a comparable population to start. Then you'd have to actually model it out. But the best example that I can think of is, well, sorry, let me backtrack for 1 second before I get to the example. The theory is that the shortages in healthcare are largely driven by lack of supply, not rationing of supply. So there aren't enough doctors is the problem. If you had more doctors in open competition, it would drive price down. Now, the best example of this is in laser eye surgery. So laser eye surgery in the United States is almost entirely deregulated. It's not covered by insurance for most people. It's considered an elective surgery. And that means that doctors actually have to compete on the open market. One of the big problems in our healthcare system is if you walk into the doctor's office and you say, I want an x-ray, how much will it cost me? The doctor literally will not tell you. The doctor literally can't tell you because they have to run it through the insurance company. They have to bargain with the insurance company. They may be covered by this insurance company, but that insurance company. In a socialized medicine system, they just say zero. Well, that leads to an increased demand because there is an elasticity of healthcare demand, and that leads, in essence, to shortages in healthcare supply. Overall, that means that people may live longer because people can access healthcare whenever they want, supposedly. But it also means that when it comes to elective surgeries or when it comes to surgeries that can be delayed, those are delayed very often, and that's something you see from the National Health Service. When it comes to completely privatized systems, if there were complete transparency in price, then you would see an actual supply-demand curve. This is what you see in laser eye surgery, which used to cost $20,000 an eye, $10,000 an eye, now costs like $2,000 an eye because every single doctor went into ophthalmology or optometry, all of them. Right? There are 4 different fields in medicine. My wife's a doctor, as everyone knows. I've said 1,000 times. So that means that virtually everyone in her class went into what they call the ROAD system, right? Radiology, ophthalmology, anesthesiology, dermatology, mainly because those are the least regulated areas of the healthcare system, where you have to deal less with insurance. So I think that there's almost two separate questions with regard to healthcare. How well are the systems in Britain and Canada working? And by the way, if I were going to pick a socialized healthcare system that I think works best, I'd pick Switzerland, actually, where there's an actual mandate. But I think that because it actually is more privatized and there is some competition in the marketplace. But if you're just talking about what could you do to make the American healthcare system better, we're basically at the worst available points. If privatization is here and nationalization is here, we are here. Right? We're just at the low point of the curve. So I think if you move in either direction, it will get better, probably, in certain ways worse. I'm also very much afraid of a government that comes in and is going to have to mandate how doctors care for patients. Because one of the problems that nationalized systems have had is people opting out of that, doctors opting out of caring for patients in this way. They've had to import doctors, for example, in places like Britain. There's a shortage of doctors in places like Israel, because who wants to go through 1,000 years of medical school to make 60 grand a year?
Thank you very much.
First, I'd like to say thank you for coming, especially after the reputation we developed last year. So my name's Ian. I don't necessarily agree with you on everything, but that's why I came here. I'd rather be here than my own echo chamber.
Well, thank you. I mean,
so you said that you consider transgenderism a mental disorder, which is something that I don't know enough about to properly debate you on and criticize. So more broadly, that then brings me to ask, do you think that the United States should do more to develop proper infrastructure to take care of people generally who suffer from various mental illnesses, or are we doing a fine job?
No, so the answer is yes. I think that the typical route of taking care of people who can't take care of themselves more broadly, and I don't believe, by the way, that every form of mental illness requires an entire system of infrastructure, right? I don't think that a transgender person is suffering the same type of mental disorder as somebody who has severe bipolar disorder, for example. And my grandfather, on my father's side, my dad's dad, suffered from either manic depression or actual schizophrenia and had to be institutionalized for a while. That's a different thing than transgenderism, for example. So the treatments are not the same for every mental disorder, of course. But the idea that people who can't take care of themselves need some sort of net is well established in sort of American public life. But I would suggest that the place that you start is the place that everyone starts when they need help. You start with the family. If the family can't help, then you go to the community. And I mean generally the religious and social community. If that can't help, you go to local government. If that can't help, state government. If that can't help, federal government. One of the great tragedies of our mental illness system is that it's been federalized. So it used to be that local and state communities were largely responsible for funding mental health facilities. In the 1960s, JFK, because he had a sister who was mentally ill, thought that the federal government could do a better job, and he actually imposed from above